Insulin by pump. The school nurse, when available, is the most appropriate person in the school setting to provide care for students with diabetes. However, many schools do not have full-time nurses. Even for schools that do, the nurse may not always be available at all times during the school day, during school-sponsored extracurricular activities or field trips, to assist with routine care and emergency care. Trained school personnel must be available to perform and assist the student with diabetes care tasks. This presentation is not intended to provide legal or health advice. Please consult with a legal or healthcare professional regarding your specific questions or needs. Each training component was created specifically for school nurses and other qualified healthcare professionals to train school personnel. This unit is Insulin by pump. Participants will be able to understand the basic types and features of an insulin pump, what pumps do, what is the essential information and skills for key school personnel who might perform or assist in entering data or delivering insulin with a pump. In addition to understanding insulin dosing and delivery using an insulin pump, it is important for school staff who administer insulin to a student or assist a student with insulin administration understand the fundamentals of insulin action, dosing, and delivery. These general concepts are covered in the unit entitled Insulin Basics. An insulin pump is an external battery-powered device that continuously delivers insulin in small doses to the body. Most pumps look very much like a pager or a phone and can be attached to a belt or waistband, carried in a pocket, or held with a strap around the arm or thigh. The pump contains a cartridge or reservoir for insulin. These pumps deliver insulin through a tube as shown in the large picture on the screen. The pump connects to a narrow, flexible plastic tubing that enters with a short plastic catheter inserted just under the skin in the abdomen, buttocks, or thigh. Users set the pump to give a steady trickle or basal amount of insulin continuously throughout the day. Pumps release bolus doses of insulin at meals and at times when blood glucose is too high based on the user's programming. Some pumps, like the one listed on the slide, are attached directly to the body. This newer kind of insulin infusion pump is often referred to as a pouch pump or pod. This type differs in that it adheres directly to the skin without using additional tubing. It is a disposable unit that is controlled by a separate PDM device. In the pod type pumps, insulin is still continuously delivered through a small plastic catheter on the underside of the pod and inserted just under the skin in the abdomen, buttocks, or thigh. An insulin pump delivers one type of insulin, no mixing types. Newer models have a number of calculations and reminder wizards. For example, to assist calculating an insulin bolus dosage based on carbohydrate intake and blood glucose level, or to remind users about active insulin while dosing. Pump therapy is based on what the pancreas does naturally, delivers small amounts of insulin all the time, and then at meals or snacks, extra insulin is delivered to cover that amount of food. Pumps generally dose rapid-acting insulin. Students who are on injections use both long and rapid or short-acting insulin. Generally, their long-acting insulin will be taken either once or twice daily. The pump delivers insulin in microdrops that are continuous and accurate. The level of activity directly affects how quickly insulin goes into the bloodstream. When sitting at a desk, it will go into the student's system more slowly. If the student goes for a walk or a run, it will go into their system much more quickly. The primary advantage of pump technology is in how it facilitates basal insulin delivery. It allows for finer adjustment and greater accuracy in fractional doses, for example, 2.2 units. Additionally, pump technology is a more convenient way to deliver the multiple bolus doses throughout the day without having to inject each time. Those pumps that monitor on-board or active insulin also help to prevent overlapping doses that might lead to hypoglycemia. With the ever-changing capacity of portable technologies, many pumps can do much more than simply deliver insulin. For example, modern smart pumps have a bolus calculator, which calculates how much bolus insulin you need, taking into account your expected carbohydrate intake and current blood glucose. Some pumps communicate with blood glucose meters or continuous glucose monitors to help with analyzing management decisions. Some track and signal active insulin. Some allow for temporary basal rates, for example, lowered during physical education. Some are capable of data sharing with the caregiver remotely. However, communication is dependent on their connected smart device. Real-time data sharing with the caregivers and/or school staff should be specified in the student's 504 plan. However, all pumps must still rely on input from human beings to determine dosing. The user still has to enter information about carbohydrate intake and glucose levels in order for the pump to determine and deliver the correct dose based on the settings that are pre-programmed by the student, parent guardian, or healthcare team. Not all pumps calculate dosing. In those that do calculate, the user is able to override the pump calculated dose manually. An insulin pump requires programming, close monitoring, and frequent glucose checks. Pump settings are determined by the student, parent guardian, and healthcare provider. More advanced artificial pancreas systems self-adjust insulin delivery based on CGM data. These systems may be used to help the student stay in target glucose range. It's not expected that school personnel would understand all details of each system. However, it's important to understand that the system is dependent on sensor information to continue in this hybrid closed-looped mode. As always, management details should be outlined in the student's DMMP and/or the student's 504 plan, since many of the system features are dependent on what type of system and how the student is recommended to use the sensor. Hybrid closed-loop systems available today include Tandem's X2 with Control IQ and Medtronic's 670G and 770G systems. Several systems now exist, and technology continues to evolve. Recommendations for use will vary depending on the system. The Tandem X2 with Control IQ system allows automatic microinsulin adjustments to help keep students in goal blood glucose ranges. CGM values may be used to make treatment decisions if the conditions discussed in the CGM have been met and the student's DMMP states the student can use the device to make treatment decisions. It is important to address any alerts, including CGM unavailability, to continue control of the IQ delivery system. The Medtronic 770G and 670G systems allows automatic microinsulin adjustments to help keep students in goal blood glucose ranges. Blood glucose testing still required by student for treatment decisions per the DMMP. It is also important to address alerts including inter-BG or calibration requests immediately to continue auto mode delivery. Each hybrid closed loop should be disabled if insulin is provided by injection for ketones. This is to prevent insulin stacking and related risk for hypoglycemia. Students who cannot self-manage independently will require help responding appropriately to alerts or CGM alarms. Depending upon the developmental level of the child, the school nurse or trained school personnel may need to perform or assist students with pump functions. Each pump requires specific training. Some students, especially younger ones, will need assistance with calculating or entering in the correct carbohydrate or blood glucose values, both to cover for meals or snacks and to correct for high blood glucose. The school nurse or trained school personnel should be aware of the signs and symptoms that an infusion site may need to be changed. Ordinarily, infusion sets are changed every 3 days. Additionally, the DMMP specifies when an injection by syringe or pen is needed and when to assist the student as needed in administering insulin by syringe or pen if blood glucose is far above the target range, is not responding to a correction bolus, or if ketones are present. Rarely, a pump may need to be suspended or disconnected if a student becomes unconscious or experiences a seizure. Staff should be trained to perform or assist the student in performing suspensions or disconnections as per instructions from the parent guardian or healthcare provider as specified in the DMMP. For example, some students may disconnect during physical education class or during extracurricular activities. There are a number of different pumps on the market. Pump manufacturers are often the best resource for training resources and education and commonly have quick references available. The method of insulin delivery is determined by the student, parent guardian, and provider, and therapy may change. It's important to be prepared that students on insulin pumps may still require injections during cases of pump or pump site malfunction. In cases of pump or site malfunction, call the parent guardian per the DMMP. The following supplies should be provided by the parent guardian and kept in a designated place at school. Infusion set, reservoir, insulin, skin prep items, alcohol wipes to clean top of insulin vial, syringes, pump batteries, inserter if used, and a manufacturer's manual with an alarm card. In cases where the pump is disconnected, it should be placed in a secure place as designated in the student's written plans. In cases of site malfunction, the site should immediately be replaced and/or insulin should be given by syringe or pen as per the student's DMMP. Call the parent guardian as per the DMMP to confirm backup plan. Infusion set placements requires training and is routinely done at home, but students who have been identified as capable of managing independently, may carry pump supplies for immediate site change as necessary.